Well, we have signed a number of important contracts, distribution contracts in the Scandinavian countries, in Greece, in Italy, in Spain, in Portugal, and we even have a long-standing cooperation with United Truck in Ireland. So we now have the distributors to launch the products. We are producing products right now. We got the first delivery for sales on Saturday. So this week is the week where we're going to have the first sales. And we are going to launch no less than 3 product lines this year, starting with the clip Ven ported line, and then later on the clip Ven winged and the swing products. However, we are now very close to the summer holiday season, and therefore we do have, or we will have, the first sale right now, but September, October is probably more realistic to be the months where we will see the higher sales take up. Yes, during 2014 we will have the ramp-up process as just explained, so that for 2015 we are ready to sell the full line of product, and we have ramped up production and we have capacity. So 2015 will be a very interesting year, because that's a year where we can roll the products out and have sufficient capacity. For 2015 we are also planning to launch the third product line, which we haven't indicated what product it is, but late 2015. And in 2016 we expect to launch in the US. And if you combine all those products and markets, Europe, US, the 400 to 600 million Swedish krona is the amount we as a board and as a management team believes is realistic. Yes, first of all, it's very important to understand why we are using EBT, earnings before tax, as our key figure. Because we are outsourcing production and we are not having our own distribution, which means that interest rates and depreciations, they are actually included in the price of the product we buy from our suppliers. And therefore, if we had used EBITDA or EBIT, it would not have been a correct comparison to other companies. But using EBT, we can actually compare with other medical device companies and get a fair picture. So it's important to know why we are using EBT. The EBT of 13 to 17% is what we find realistic. Of course, in the beginning the costs are higher, but we believe that we can get that margin seen over the next couple of years. And looking at the prices we have in the contracts with the contract manufacturers already. Well, the interest is certainly there, and we do have negotiations going on in France and in the UK. We have had some initial discussions in Germany also. But now we have to balance the capacity we are able to produce and the number of distribution agreements we sign. Not to get too many distribution agreements without the capacity to deliver. It's a positive challenge, but that's also a very important consideration for the management team. For the US, it's really a question of upgrading our quality systems to the requirements of FDA. And also we need a 510(k) approval for any product we bring into the American market. And that will take us about a year to do. On the other side, it will also take us about a year to make a new assembly line to be able to produce the specific products for the US market. And it will take us some time to identify the right partner and to identify the contract manufacturers. So it's probably realistic that we can launch in the US in 2016. And China is a great opportunity, but it's a different business case. and it's very important to emphasize that it's not included in our financial objectives. So we will inform the market when we are ready with a business case on China.